tool. I'll just walk through a couple of examples, or just one example. So if you wanted to choose, say, a region, let's look at Arizona, uh, Maricopa County. You'll see that we have the hospital ratings, some further drill down, and then kind of a distribution of what these are. So this tool, because it's powered by Google's BI engine, allows you for sub-second retrieval. So there's some technology in the back end to make this really quick. If you look at Mayo Clinic as an example, they have a five-star overall CMS rating. And what I found from doing an analysis of just 4 metrics, these mortality, safety, readmissions, and patient experience basically drive like 80 to 90% of this metric, the overall. So a value of 1 means it's above average, 0 means it's at national average, and -1 means it's below national average. So since it's only in 3 categories, there could be some sensitivity. You know, Banner could be just below national average and be considered below national average. So you kind of want to look at the totality of these. If you jump over here, you can kind of see with Mayo Clinic relative to the nation on pressure sores, hips and knee complications, and wounds. So anything less than 1 shows that it's below average as far as complications with pressure sores. Anything above 1 means it's above the national average. So Mayo Clinic, as you can expect, is below on these on 2 of the 3 wounds, and that could be because of case mix or something where wounds is slightly above average. So you'll see down here that at Mountain Vista Medical Center, it's the overall ratings 2. You have much higher pressure sore issues that could be related to staffing, it could be related to caseload. So you know, being understaffed for nurses and nurses assistants can be a sign of there being lots of pressure sores. So down here you can kind of see distribution for whatever you've chosen here. You see a distribution of the overall rating, the mortality rating, safety, readmissions, and patient experience. If you go to page 2, you'll see some information on cost. So you can click on cost, and then again, we'll look at Arizona. This version now is not on the county level, at this level, it's just the city level, so we'll just look at Phoenix. So if you look at Phoenix, you can choose by DRG. These are across all DRGs, or you can choose a specific one. What it shows is it shows the average Medicare rate versus the average total. So the total is going to be a combination of all payer types, whether it's the commercial side through employer-sponsored insurance or Medicare, Medicaid, self-pay, etc. So this will be, in some ways, the ratio of these two will be understated because Medicare is included in the numerator and the denominator. You also see a DRG count. So at this Maricopa Medical Center, there's 277 DRGs represented in this group. And you could see a little bit further drilled down here. So if we were going to look at one specific one, let's say joint replacement. Let's just look at joint replacement. You can see at Mayo Clinic, the average Medicare rate for these 535 DRGs is about $14,000. Average total payment across all insurance types is just south of $20,000. And then this number here is the ratio of the total to the Medicare. And again, Medicare is about 2 times less than what commercial insurance pays, but since it's included in this number and this number, it's going to show you a lesser number. But you can kind of see across these that in this example that the total payments is higher than it is for Mayo than it is for, say, St. Luke's. St. Luke's is going to be less expensive for based on the numbers we have here in these caseloads. So it's interesting. You can look at high level, or you can drill down and see a specific if you want to look at hip and femur, there's going to be fewer here, but you get a sense of both price and quality, and then of course you can look at it any city in the country. So if you wanted to look at, say, North Carolina, you just come in here and you hit in North Carolina, and then you can look at specific cities, and let's say you wanted to look at Charlotte, you can look at the hospitals, and then you can add underlying areas as well to see where prices are. So it's an interesting tool. It mixes different diverse sets, and the Medicare numbers are trended to 2019. It's actually 2015 data as of the total payments with slightly different factors. So those are the numbers there, and that's it.